Hi everyone, I'm Dr. Allen, and this is another Counseling Skills class mini lecture. Today we are going to be covering challenging skills. Since this skill tends to be a hot topic, we're going to first start by processing our understanding of challenging in counseling. Then we'll talk about the two different types of challenging skills, followed by how to use them, and then talk about a couple considerations. So using the skill first starts with getting comfortable with the idea of using them. If you have a strong reaction to the idea of confronting, pushing, or even disagreeing with someone, especially a client, then you might need to put a little bit of extra work into reflecting on where those feelings come from. It's okay if you do, and now's the time to start addressing it and reflecting on that. Or conversely, maybe you're comfortable with confronting and you're excited to. So ask yourself, what comes to mind when you think of confrontation? Is it arguments? Is it something that's loud, aggressive, or even combative? Really take a moment to pause and reflect on that. Even pause this video if you need to. Now, if you notice you have some of those beliefs, let's find a way to reframe what a confrontation can look like. Because it can be done in a way that is respectful and helpful, and that it's not scary to give or to receive. So let's talk a little bit about how we can make that happen. Now, it's first by reconceptualizing what confrontation is. Here we have this diagram of an XY axis with the Y axis with describing the level of confrontation, where the X axis describes the level of support. Now, in that top left corner there, we see criticizing. And this is where there's a high level of confrontation, but there's a low level of support. Now, this might be what you think of when you hear about the word confrontation. However, this is only when the confrontation is high and there's no support there. It can come off as critical, shaming, or even blaming. It results in low self examination and low trust because the client doesn't even want to look inward because they don't trust that the counselor is there for them. So the topics discussed are going to be really superficial. Now, if we take away that confrontation totally and just leave low support, that leaves us with ignoring. And that is negligent. That's just sitting and looking at our client and not doing anything. It results in low self examination and trust. And the topics discussed again are going to be superficial. Now, let's keep that confrontation away, but increase support. That's what counseling is, right? Kind of, but that's more befriending. And our goal is not to befriend our clients, is to be their therapist. And so befriending looks like a high level support, but low confrontation. Now, that mm, tends to result in relatively low self examination, but high trust. I trust that you're going to listen to me and support me no matter what I say. Now, the depth of the topics varies. Like when you have a friend, they might call you out. You'll go deeper. Like if they ask you like what's going on, that's your thinking face. So it can vary, but typically it's going to stay low in those more surface level areas or really not go too deep. So how do we help our client? We want to move that level of confrontation up just a smidge and find that balance between high support and a moderate level of confrontation, but not too high. And that'll help us have high levels of self examination and moderate to high levels of trust because our client knows that they can share anything with us, that we'll meet them non judgmentally and help them look deeper into the things that they do share. Hopefully that helps you reconceptualize what confrontation looks like. It's not completely negating the client any chance you get or calling them out negatively. In fact, it can be done conversely to help call them out for things that they're not seeing that are positive about themselves. And it always must come with a high level of support and care. So with that, I like this little image because it points out the fact that we tend to call it confrontation, right? We're challenging, we're confronting. But I like to refer to it more as carefrontation, empathic carefrontation. Super cheesy, I know, but I think it works. So when do we challenge? We want to challenge when a client shares self-misinformation, maybe whether it's purposefully or unconsciously, when they state those non-truths about themselves. It could be something like them saying they're stupid and that they never get anything right, but that's not true. They might have mistaken ideas and beliefs, so they might think that having a baby will save their marriage. Or they misinterpret others' actions by mind reading. So this is when they state that they know exactly what the other person is thinking about them, that they know that they think that they're lying or that they don't care. Um, It could also be blaming others instead of looking at themselves. Maybe they're blaming a boss for missing a deadline when they didn't read their email. It can also look like not working on goals in therapy. Maybe they come to session and they just sit down and they just start like word vomiting, for their lack of a better term, and talking about their day, the movie they watch, or showing you pictures on their phone, rather than focusing on their goals, or maybe they're not doing the homework that they set out to accomplish. And then finally, we might challenge when we notice inconsistencies in their thoughts, feelings, behaviors, or values. And these are called discrepancies. Now, there's several different types of discrepancies, and this is when there's an incongruity between what a client says, so their verbals and their non-verbals. So, for example, you might call a client out or use a challenging skill if a client says that they're upset, but they're laughing, and that's incongruence. And you can do that by saying something like, I notice that you say that you're upset, but I also see that you're laughing. You might notice an incongruency between a client's beliefs and their experiences. So maybe a client believes that they're starting to lose faith in God because if he existed, bad things wouldn't have happened to them, right? However, they've also shared with you stories about how God has shown up in their lives time and time again. Now, you might notice a discrepancy between their values and behaviors. So they say they value trust, or you notice that they value trust, and yet they won't tell their spouse the truth about their spending habits. There might be discrepancies between verbal expressions and behaviors. So this is when they're not sure about continuing therapy. They tell you every week, I don't want to come back. And yet every week they call the front desk and they make an appointment and they end up back on your schedule. Uh, you might notice that they have a discrepancy between their life experiences and then their plans. So you've spent time and time in session talking about how a client realizes that their relationships aren't working because they rush into them too quickly, and yet they tell you that they're about to propose to their girlfriend in 3 months. And then you might also notice a difference between two verbal messages. So they say that so and so is their friend one part of the session, and then later on they say they don't even like Joe or that person. I named them Joe. Uh, so this is the skill that you use to start pointing out, or you use challenging skills to point out these discrepancies in a helpful manner. And you could do this two different ways. There's giving feedback and then using empathic confrontation. I'm going to go into what these mean in depth in a moment, but I want you to know before we do it that these are both very powerful interventions and they must be done only when there's a good therapeutic rapport. This is not a first session skill. And will likely result in a client not coming back because you haven't developed that relationship yet. You haven't shown that high level of support. So giving feedback. This is when a counselor shares information that they see, feel, or suspect about a client. This is a form of self-disclosure on the counselor's part. Now, it's best to only give it when the client asks for it. So if they might ask, like, do I really come off as needy? Or do you really think I'm that confrontational? Oops. Or you might use it when a client needs that information to progress. Maybe they are stuck. You've been talking about the same thing week after week, and they haven't been making progress. Using this kind of skill can help push them. And I'll talk about how it does that in a moment. So the purpose of the client is to indicate maybe how a client's behavior affects you. You're noticing that some of their behaviors affects you a certain way, and maybe that reflects how they impact others and can explain why they're having interpersonal issues with people in their lives. So, for example, if you notice a client is always critiquing parts of your office, and that makes you feel insecure or uncomfortable or anxious for that client to come in, you notice that you start cleaning up your office the minute before session so that they don't say anything. Well, gosh, if you're noticing that about you, do they interact with their loved ones? Are they super critical of their spouse? And that's why maybe that explains the tension that they have uh, between them. And so that can be really valuable information. You're sharing what's happening in the here and now between you and the client, not to have them validate your feelings or apologize, but more so, it's a tool to help them see themselves differently and help them make changes in how they interact with others to hopefully better their relationships or whatever it is that their goal is. You can use it to evaluate a client's progress towards goals. So maybe they don't think that they made any progress in therapy, but you can point out, well, those things might not be changed, but I notice that when you talk about this, you no longer break out crying anymore. In fact, you can talk about it from a strength-based perspective. Um, and so that in itself can be helpful as well. And I just like this quote from Jung. He says that clients need accurate feedback to confront inconsistencies in their own attitudes and to know that they are affecting others or how they are affecting others. So, how do we use this skill? Here's a couple quick tips. You want to use I messages. So, I feel uh, insecure when you critique my office every week. And again, use that not about you, but to explore, is it something that happens in your life with others? Now, don't give feedback on a person's personality traits uh, or other immutable characteristics that they can't control. You want to be specific, concrete, and non-judgmental. And it's typically helpful if you ask for permission before giving feedback or given in a way that's stated like tentatively of like, I'm noticing and I'm really curious about this. I'm not sure if I'm right there. And you only want to give one piece of feedback at a time, max two. You don't want to overwhelm them with a laundry list of things that they're supposed to fix. You also want to give feedback that emphasizes a client's strengths, not just their weaknesses. So this isn't only calling them out for the things that they're doing wrong, but also maybe things that they're doing right that they're not noticing. And just check in afterwards to determine if it was received well or how it was accepted. So some examples of giving feedback, it can look like, you say you want to be assertive, that you've been doing this, but I experience your behavior is really like passive when you look away and avoid eye contact with me. And so this particular one, you also want to be mindful of culture. And so that is not going against their culture as well if they don't make eye contact as part of respect in their culture, or if it's a personality trait or like a trait of autism. So that's another thing to keep in mind when you're talking about using the skill. Another example is as I see it, you've been successful in overcoming your anxiety by facing situations that you have been avoiding. Or it can be something as simple as, I notice that you never seem to talk about your father. So just hopefully you see how powerful those can be, but they also need to be done in a respectful way. I like to call these high risk, high reward kind of skills. So looking at the other type of skill in challenging, it's counselor empathic confrontation. So this is an intervention where a counselor directly points out discrepancies in the beliefs, behavior, words, or nonverbals of a client, like those I mentioned earlier. You only use this after you have a good relationship with a client, and you don't use it to blame or shame them. And you want to use them after this issue's been raised several times. It's something that you've noticed, you put in the back of your mind for later, right? And you've noticed that pattern. And this is when you pull it out. As I just mentioned, you want to understand the cultural implications first. And the reason why these skills work is that it creates emotional arousal or tension by pointing things out. This is called cognitive dissonance. Now, cognitive dissonance is a mental discomfort experienced when holding two or more conflicting beliefs, values, or attitudes, or when someone's actions contradict their beliefs. So, this psychological tension actually motivates people to change, and they're motivated to change because they want to reduce the discomfort. So they'll either do that by changing their behaviors or changing their beliefs. Now, how do we use confrontation? Just like any skill, you'll find your own way to do it in time as you get more comfortable, but these are some formulas that can help you start doing it now. So this one's the most popular on the one hand and on the other hand. So on the one hand, you say you've had a horrible year, but on the other hand, you've told me some really big accomplishments you've had. Another is, you've said you were happy, but I don't see that on your face. You clearly value family, but you also spend nearly 60 hours of each. Ooh, you spend nearly 60 hours at work each week. You said you were excited about what you were learning in graduate school, and yet you haven't been doing your assignment. Now, notice what you feel when I say each of these things. You might notice that own discomfort of like, ooh, she just said that? Yes, that discomfort is part of it because that's that cognitive dissonance, right? That's what causes that motivation to change. Now, this is important. As a counselor, when you use this skill, you use it and then you drop it and you back away. Do not add a bunch of qualifiers. Do not add a bunch of questions. Do not try to fill that uncomfortable silence that occurs after you say it. Why? Because you're doing that to save the client. We do it because we hope that if we drop this confrontation and then we add all this extra stuff in the questions and the filler, that the client's going to respond to those things rather than the confrontation because it's vulnerable. It feels confrontational because it is. And that negates the whole purpose of the skill. So drop the confrontation and back away. It's going to be okay. And if it's not, that's information too. Right? I often hear counselors in training ask, well, what if a client disagrees with the confrontation? It's like our worst fear, like a client disagrees. Like, no, that's not true. Well, that is possible. It could have been a bad confrontation, or also likely, a client's not ready to change. And so instead, when you drop a confrontation like that, or if they even have that in their mind, and they already have that cognitive dissonance, they will alleviate it by rationalizing, by ignoring, or by avoiding that conflicting information. So instead of changing. Now, a way that you can conceptualize this is using this scale, the client change scale. And you can kind of look at that and to kind of help you understand, like, how does that client take that information? Maybe they completely deny it or they don't even hear it. You just drop that confrontation and they just keep going. Or maybe it's partial, right? They'll discuss it, but not all of it. And so that could be like a 2 or a 3. Maybe they discuss some of it, but they're not willing to change it. I call this like a yes, but, right? Most clients that you'll say things, well, yeah, but this only happened because of X, Y, and Z, right? They're not ready to change yet. You might have those who see that incongruity, but they're not ready to change. They don't want to change it. They'd rather live with it. It's more comfortable that way. And then there's those clients who are ready to change. You notice it and they see it, and then they start altering their behaviors or their choices when faced with that change. Now, this is just a kind of a mental tool for you. It's not something that I hear counselors talk about all the time of like, oh, my client's on this scale of 3 on the client change scale. And I've never seen it on a test before, but I like it because it kind of helps me conceptualize of like, okay, the client's not quite there yet. I also like the stages of change. That may be something we'll talk about in another video, and you can look that up as well, the trans-theoretical model of change. It's another way to conceptualize client readiness. And that's really important to consider when we think about what skills to use with our clients. If you notice that you're dropping these awesome, challenging skills and the client continues to deny, maybe that's not a skill to use with them, or at least not to use with them yet. You have to do some other things. You need to build more support, build more rapport before you use that skill again and use it effectively. All right, last thing, can you use humor? Sometimes. Maybe that's part of your personality. Maybe it's part of your clients. It can be a way to make a confrontation maybe seem less confrontational. But again, you got to use this with extreme caution. And you don't want to do it to belittle in a way that belittles or conveys that you think the client's concerns are unimportant. So, like, don't be mean. And so you got to, and you might be able to use it with a client where that's just their style of communication. They like to joke, they like to banter back and forth. And so with those kinds of clients, you might be able to use something like exaggeration. So if you have a client who frets over the possibility of getting fired and becoming homeless because they're going to turn in a project a day late, you can combat that. Well, yeah, clearly you're never going to be able to get a job again because you got that one thing wrong. And give them the look. I can do that with some clients. They might be able to be like, ah, yeah, I know. It kind of breaks them out of that negative thought cycle. But again, use those with caution, be mindful, and only once you have that therapeutic report. That was a lot, I know. It's a big skill. It's a scary skill for some of us, but it can be really helpful for helping our clients make some progress. If you have any questions about it, feel free to email me, Dr. Allen at lkallen@scu.com. I look forward to talking with you soon. Good luck. Take care, everybody.